are factors that can make someone to be prone or at risk for kidney related problem, and one of those factors are factors like um, um, factors like hypertension. You know, one of the main causes of kidney related problems are hypertension that is uncontrolled. And that's why I always say to people that, look, if you are going to do anything that is going to make you not to check to use medication for blood pressure, you cannot manage your blood pressure without checking your blood pressure regularly. So live on YouTube, live on Instagram, live on Facebook, I would want you to send in your questions before I would take more questions. I'll one question that I have been able to answer your question about whether kidney disease is hereditary. So not necessarily, but I mean, we've seen cases of even young people having kidney related problems. And kidney disease is actually a chronic ailment, although it can suddenly, you know, but happens in old people. Young people, I've seen cases of even people as young as 12 years old, 10 years old, that some other persons have had kidney failure from addiction. There are some. Okay, so because your grandpa died of kidney disease, what you need to isolate is the cause for. Some people have kidney as a result of allergy. Aware of what you're allergic to, it may affect. I hope my sound is clear. Okay, so they also make the child and make the child. But the truth is that check your blood pressure. So you have a family history of pressure or high or diabetes. Some people have, yes, I hope it's better. Please, can you hear me? Can you tell me if you can hear me? So some people have family cases where somebody has allergy, and this allergic reaction may this allergic reaction may cause family history of diabetes. Is there a family history of hypertension? These are questions that I need answers for. But that because your parent had diabetes doesn't necessarily mean that you must have it, you know. So I hope I've answered your question. So I was talking about allergy. There are some drugs, there are some allergic conditions that directly have impact on the kidneys. And so if you are experiencing those allergic conditions, those allergic conditions may directly affect you. Yes, they may directly affect. Those allergic reactions may directly affect your kidneys and may cause you to have acute kidney failure, or even cause the person to have chronic kidney disease or chronic kidney problem. So I hope I've answered your question. Thank you, Dami, for joining us online. So if you have any other question, you can bring it in. But I have a question here. Someone asked a question that I thought I should talk about, and the question was asked in one of my videos, and the person said, what is the difference between a chronic disease and an acute disease? The truth is that chronic disease is a disease that starts suddenly and persists over a period of time. It's usually a long time, it persists over a period of time. An acute disease. You can't hear me on YouTube. Oh, Jesus. The audio is very bad. I'm surprised at that. Is it better now? Can you let me know? Okay. Is it better now? Can you let me know if the sound is better now? Thank you. Okay. So, all right. I hope it's style, diet, usually plays a very huge impact when you are dealing with chronic ailment. When you are dealing with chronic ailment, it is your lifestyle, your diet plays a very key part in reversal, in maintenance, in even in restoration of health, especially when the person is experiencing pain. All right, Fatai, thank you for joining. I'm waving at you. Welcome to the program today. If you have a question, you can drop it. Talking about I'm talking about the today I'm talking about I'm dealing with kidney related problems, and I'm answering questions that relate to the kidneys. Thank you, Dr. Taiwo Anjorin. Thank you for joining us in this program. You can ask your questions. Thank you so much for joining. If you have a question, thank you so much, ma'am. Thank you for coming live on the show. I appreciate you so much. So I have another question here that a person asked on one of, okay, thank you. You said the audio is better now. All right, thank you. Okay, so the person was asking the question. I'm just trying to bring it out. Just a second. Um, about kidney stones, and that so I've done a video about what are kidney stones. If you watch on the page, you will see videos that I've done on kidney stones. I've talked about tests that you can do to care for your kidney. I've talked about the different stages of kidney. So I would not want to go over the things that if you look at the page, you will find a lot of the videos that I've done relating to the kidney. But this person was asking that what can he do concerning kidney stones for her child rather. I'm trying to look for that question that was asked this morning. But I want to first of all say I'm very sorry for your child, for your child's condition, and I feel sorry that such a young person is uh, actually going through such a condition. He said, how can one handle kidney stones? As my son was discharged from the hospital yesterday, and the scan he did is being interpreted by the doctor as kidney stones. Please kindly help, ma. All right. Um, Thank you so much. Mr. Shegun Tebe, thank you for joining. Damitiri, thank you for joining. Thank you so much for joining. I appreciate everyone for coming up on live. I'm waving at you. Please wave back at me. Looking at question. Okay, thank you, doctor. He said, if someone is already doing dialysis, is there a remedy, or there's a recommendation when there's a recommendation for a kidney transplant? I'm going to answer this question. Let me just finish answering this, because this is a very important question, and this is a question, one of the questions I intend to answer today. So, if you're already having kidney stones, now there are different sizes of kidney stones. It depends on the size of the kidney stone. If the kidney stone is very small, I don't know what the report is saying. I've not seen that report. I don't know what other things has been said about. You said the son has been discharged from the hospital. What is it being treated for? So there's a lot of questions that I have that I require answer to be able to give you a proper help for this. But I'm going to say that kidney stone, when someone has kidney stone, there are natural things that we can do to help you naturally pass out these stones. But it depends on the size of the stone. It depends on other factors like what is the existing health status of this person, you know. So I cannot give a general remedy, but one thing I can say to you is that something like drinking a lot of water is very good. If you have kidney stones, the more water you drink, the better it is for you. You could pass some of them. And then a fruit like berries vulgaris, I did a study on it. If you go check, that plant is very good. It's a plant that you can eat, you know, eat a lot of it. If you require it, we have it available. You can get it. You can get 50 grams, 100 grams, depending on the quantity you require. You know, get that fruit, you know, take it. It has ability to break down, you know, calcified stones, calcified minerals as what we know as stones. You know, it has the ability. So that is a natural plant that can help you. But then I don't know what other conditions you are having, so I may not be able to provide you with more information. Fruits like cranberry help you. Um, Fruits like watermelon, pineapple. I did a review of watermelon yesterday, and I even told you how to do watermelon tea. So these are therapies that you can do to help your kidneys. You know, if you know that you have a history of kidney stones, you need to stay away from lemon. And this is one of the reasons I tell people that lemon is not bad in itself. It's a good fruit. The problem is that people overindulge in it, and lemon has what is known as oxalate. Oxalates are one of the things that become crystallized in the kidney, in the bladder. It's not only in the kidney that stones can form. Stones can form in the bladder, stones can form in the kidneys also. Now, when you consume foods high in oxalates, foods high in uric acid, these foods that are so high can make you to have kidney stones. So even though you are eating something natural, it is also important that you are not overindulging in it. I see how people, lemon is one of the fruits that people abuse a lot. They abuse it, they take it so much, they take too much of it. And over a period, in fact, some people make all the water they drink all day is lemon water. That is too much. You just carry lemon, put inside water, bottle, big bottle, that all through the day. So in a month, all the water you are taking is lemon. That is not very good. That is not healthy. You see, everything must have regulation, everything must have moderation. So you cannot just be drinking lemon, drinking lemon, drinking lemon. We have rise of kidney stones now that people are more health conscious. Why do we have more incidences of kidney related problems? Now that people are trying to live healthy, why do we have? Because sometimes you are doing too much. Too much of everything that we do can be a problem. So there has to be moderation. Some of the herbs that we drink at home, some of these home remedies we do, because we are not regulating it, because we are taking too much of it. See, don't be deceived. Herbs can have side effects. Herbs have the tendency to have side effects, and if you don't take time, you can find yourself on the on the on the on the bad side of it. Now, to answer Dr. Taiwo's question, if somebody is already doing dialysis, is there a remedy? Yes. Like I said, there are different stages of kidney, and I've treated quite a number of people who are on dialysis. It depends on the stage. It depends on the other condition. It was, you know, so there are lots of other factors that are available that contribute to if I want to treat the person. I have some people who are online today, right now, who I'm treating for kidney related problems. They are live online right now. I don't need to call their names for confidentiality's sake. You know, you see, in any therapy that you want to do, the most important thing is not to put yourself at risk. And that is why when you are dealing with natural remedy, you must be sure that the person is not putting you at risk. I've treated quite a number of kidney cases, and there are some patients that are still on therapy. It is a chronic disease. It takes time, you know, and then time, nobody has control of time. You see, nobody has perfect control of time, and there's no 100% perfect remedy that is 100% guaranteed to give you all the result that you want. And everything we do, we put our faith and we put knowledge, and we do not want to put the person at risk. I've treated somebody, but for me to be able to treat you, a consultation has to be done. And what am I trying to find out in the course of the consultation? What cost? Not 1 teaspoon. One lemon, you should use 1 lemon over a period of 5 days. But you use 1 lemon in a day, or 2 lemon, or 3 lemons. Some people even cut up to 10 lemon inside water. Just a matter of moderation. All right. So my brother had diabetes and then high blood pressure. Now, sorry, I have questions. Okay. All right, I have questions on YouTube. Um, Let me answer this on Instagram. So my brother has diabetes, then high blood pressure, now chronic kidney disease. He's not yet on dialysis, he's on meds. What is his fate, doc? All right, so now he has chronic kidney disease. Stage what are we looking at? Stage 3A or 3B, or 4 or 5. At 4 and 5, the person would most likely be doing dialysis already. But if he's not on dialysis yet, that means that his body is still producing. So that means that his urea and creatinine level are not very high, or that his body is still, his body is still trying to, his body is still trying, his body is still able to pass out. Because why do people do dialysis? Is needed when the kidney functions have been greatly reduced, such that the waste is not able to be removed from the body. So there's a requirement for dialysis. Actually, a filtration, external support for the kidneys. So what is his fate right now? He has good faith. I can't say he has good faith, because so since he had diabetic, so it is possible that the kidney problem is a complication of diabetes. It's most likely that that's what he's experiencing at the moment. For me to be able to help your brother needs to do a consultation with me. By the time I do a consultation, I would need to see his EGFR for me to know what stage of kidney is he at the moment. Number two, I want to also find out what caused it. You see, is it complication of diabetes, complication of hypertension, or is it the both of them? So how old is he? What are the symptoms he's experiencing? You see, so all these things are things that need to be taken. But what is his faith? His faith, he still has very good faith, because he's not yet on dialysis. Means that his creatinine and urea is not requiring, and his body is not yet requiring support from external filtration, which is the process of dialysis. So that means that there is good chances that if we do something, then we can get it quickly done. I hope I've answered your question. Thank you, Wendy, for joining. Thank you, Tina Brandy, for joining. Okay, let me answer questions on YouTube now. So what can someone do to prevent kidney stones? Drink plenty of water, reduce alcohol intake, reduce home remedy. You are taking supplementation. Excess supplementation can cause that, and then your drugs that you are using, reduce drugs, reduce the use of the frequent use of pain relief, analgesics. Usually these are, then reduce your protein intake. Your protein intake, how much protein do you take? Excess of protein, reduce. Then if you have, for your fruit, it's better you eat your fruit with the fiber. It is also better that if you cannot chew for long, or you cannot chew, it's better you blend. Blend is more better than juicing. So you blend with the fiber and you drink it, so it's a bit thicker, not with juicing, because you don't want your glycemic index to be flying up and down. See, fruits have sugar, they have simple sugar, and some fruits have higher glycemic index. Glycemic index is how fast it takes your body to absorb sugar, how fast it takes your body to take sugar. You don't want to be having spikes up and down, up and down, up and down. So when you take them in with the fiber, it goes through some form of digestion. It's not sharp, it's not quickly, easily absorbed from the body. So I believe I've been able to answer your question around kidney stones, some of the things you can do to prevent kidney stone. What could be the cause of acute pain in the waist area, which is causing pain in the left thigh? Now, this question you have asked is very generic question. It could be as a result of prostate. If you are a man, Mr. Stephen, I know you are a man. Thank you for joining us. That can be as a result of prostate. That can be as a result of hernia. It can be as a result of and you may take your body longer time to calm down from it. When you react, when you expose yourself to it, the third or the fourth time, your kidneys could be badly damaged. On your kidneys are two glands called the adrenal glands. The adrenal glands have you need to be careful. It is very important that you are very careful about the things that you are consuming, because if you don't apply tact, you may find yourself having issues that you're not supposed to have. So you have someone who they do not have a family history of a problem, but this person just comes up as a branch that just starts it. What is causing this genetic deviation? What is causing this cellular deviation? You know, these things happen because of the person, the things the person is exposing himself or herself to. Do you know that not everybody, some people react to potassium? This, there are some food that they, you know, this nkwobi, they do this nkwobi, they will put potassium. There are some food that the ogo soup that Delta State put, they put potassium. Do you know that there are some people that have serious reaction to potassium? They are not even aware that because of the level of potassium that they have in their body, they are not supposed to take, and they have hypertension sensitivity to it. What are they doing? They're not going to leave nkwobi. Then when they get home, they are wondering, they are having this leg pain that is not going. They are having this back pain that is not going. They are not connecting it. That test, if you do ESR test and it is high, go and check your diet. Check your diet, check what you are eating. But what are the common things that people are allergic to? I can just say it for you here. Corn is one thing. A lot of people are hypersensitive to corn and they are not aware. And some people are even allergic to it. They are not even aware. Wheat is another thing. You see wheat? Yes. There are people who have no business eating wheat because they are hypersensitive to it. They are not aware. They will not even go and do sensitivity test. Then you have those ones who have hypersensitive to milk, who just assume that, oh, it's just, do you know that you, the reason the acne you are having is not going to be your milk intake? Are you aware? You see, but you are not aware. So in caring for your kidneys, the more you expose yourself to the things that you are hypersensitive to, the more you are putting your kidneys at risk. So that's why you have a case where someone is not diabetic, they are not hypertensive, they have good healthy lifestyle, and then they have kidney problem. Where did that come from? It could be as a result of an exposure to an allergen. It could be as a result of an exposure to something that they are hypersensitive to. It could also be as a result of infection that has stayed in the body that was not properly treated. It could, you know, so these are things that could have caused it. So yes, I hope I'm going to take the last questions now. Uh, okay, what is the cost of berberis vulgaris for this, for the kidney stones treatment? So if you are getting the kidney combo, the 2 months treatment, the 2 months treatment costs 95,000. It has the berberis, it has the tea for kidney, the kidney teas, and then it has I think that's the antibiotics tea also. All these products, by the way, are NAFDAC approved and USFDA approved. So it has it, but only the berries, vulgaris, um 50 gram of it is 40,000, 25 gram of it is 20,000. So I've not, I don't advise anybody to take more than 50 gram, you know, at any time, because it does a lot of work on the kidneys. And if you're just using it for preventive, 50 gram is okay for you, it's just fine. But like I said, I don't know what size of stone that you're having or what you're dealing with. You can be in my DM, I would be there to answer you. All right. Those of us on YouTube, I hope you can hear me. I'm sorry about the network on YouTube, but on Instagram, they seem to be doing well. Instagram is doing very well. Thank you so much. And I hope I've answered all the questions that have come in today. I hope I have been able to answer all your questions. And if I have not answered your question, I'm sorry. Maybe I will do a video on it. So thank you so much. Thank you, Dr. Taiwo. I hope you've learned something. Um, and I hope that you put these things that I've said to work and to use. One test I want you to please try and do is your ESR test. Also pay attention to the things that you are sensitive to, things that you are allergic to. Please, one man's food is another man's poison. And take care of yourself. What test would I recommend for you to do if you want to check for your kidney? I want you to do your renal function test. Go to the lab, tell them you want to do renal function test. Please, this is not test that you will go and say they gave you machine, unless it is a scan, an abdominal scan or a scan. You can do a CT scan, you can do, you can do an MRI, you can do a scan of your kidney. Yes, that's different. But not that you just go, they just say they give you one machine. No, do your blood test. Your blood works is always very important, because that is what shows us what the kidney filters blood. So the blood work is one of the ways to tell us what is the state of the kidney. Check your kidney, check your blood pressure. Please check your blood pressure. Ensure you are checking your blood pressure. If you are taking blood pressure medication, ensure that you are checking your blood pressure, you are taking your medication. Don't put yourself at risk. If you are, then make sure that you are doing exercise. Too much exercise can also be a problem for the kidney. Next week, which is the last Tuesday in the month of October, I'm going to be talking about um, the impact of exercise on your kidney, good and bad, and where to put your balance. Remember, moderation is the key. That doctor say she's not sure whether she's allergic to anything. Anyway, I don't know, but everybody has something that the body reacts to. It's just for you to find out what exactly is that thing that you react to, and take care from there. I hope that I've answered all your questions on YouTube. I hope you've had a nice time. Um, Thank you so much for logging in today. I'm glad that you were able to learn one or two things. Glad that you were able to participate, and I look forward to seeing you next week, Tuesday, as we wrap up the kidney and we move into the month of November by God's grace, and we're going to be talking about something else. Yes, please do the ESR test. Yes, please do the ESR test. The ESR test is one of the ways for you to check if your body is hypersensitive to something else. If you also do your white blood, your full blood count, it will also check your eosinophil, your basophil, your lymphocyte, and then some all your platelets and some other tests will usually help to check if there's a deviation or abnormality in your blood, which is caused by this hypersensitivity, or if you have been exposed to hypersensitivity. But before we even go to all that one, let's do ESR test first. If it is normal, we give God the praise. If it is not normal, then you need to reach out to me so I can direct and help you and tell you the things that you can do. But if you pay attention to the things that I ask you to stop, please reduce corn intake, please reduce wheat intake, semo, stay away from those things. Eat more natural food, and then reduce milk and granules. These 5 things are things that these are the 5 classic allergens, things that people are hypersensitive to, that they may not be aware of, because the symptoms that they are experiencing is not related to what they think it is. They are not aware that is that their roasted corn that they like, or that their sweet corn that they like. Corn is not bad. No food in itself is bad. It's just that one man's food is another man's poison. And science has shown that we all have something that triggers our body. Find that thing that is a trigger for you, avoid it, stay away from it, and embrace the things that help your body. I'll see you next week Tuesday by 7:30. If you have a question, you can drop it in my DM. I'm going to compile them, and then watch out for the video tomorrow. I'm going to be reviewing a plant, cranberry. I want you to watch the video for tomorrow when it comes up, and share the video, share the page. See you next week. Have a good evening. Bye. Bye. You love roasted corn. Okay. Oh. All right. Bye. 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 Bye.
This church is in Yamala, sir. You know, they disturb me.
What happened to our
So they
video?
want on them
Jen for what?
for the get CBN something
For where?
for church. Ah, I don't get to know to get to the say for coming.
What if you did in TMP?
Take part two on the part nation this year.
Eh.
They get the last test they are doing.
They're not going to go do one for their house.